A sinus lift, more or less, is a type of bone graft. Upper back teeth are typically going to be the first ones to be lost in the mouth, just due to the increased amount of roots in the area. And a lot of times patients come to me because they want dental implants to replace their upper back teeth. The problem here is that we all have a sinus. They're just these big empty spaces, and they basically can run a little lower on your upper back teeth area. And so because implants are basically posts or screws that we're putting into the bone, there's always going to be a length requirement for us to fit that dental implant in there. And for us to get a stable implant to get a tooth, sometimes we have to do what's called a sinus lift, which is basically a bone graft up in the sinus area in order to facilitate that implant placement. Most patients are good candidates for sinus lifting as long as they're fairly healthy overall. They're well-controlled diabetics, for example, are good candidates, and patients who don't smoke are typically good candidates as well. Sinus lifting can definitely help the placement of dental implants on the upper back teeth because of the fact that you want bone around the dental implant, 360 degrees all the way around, because that's what typically supports the eventual crown or tooth. And that's what you're going to be used to be grinding a lot of your food with. A sinus lift procedure can vary in time depending on the amount of sinus lifting that needs to be done. A lot of times it can be done simultaneously as the placement of the implant itself, but it can range from as little as 30 minutes up to about an hour.